Alright guys, welcome back. Here's video 2 like we promised. Um, it is super weird to record ourselves. The first video we died laughing about. It took us probably 20 tries. This one's probably going to take us 20 tries. But thanks for being patient with us as we learn to be YouTubers and vloggers and all of these things and inspirational speakers. In today's video, we're going to talk about the attributes of Noonan syndrome. Before we do that, let's have a quick recap. When I was born, every doctor kept telling us, well, he has 10% of kids have this, 10% of kids have this, 10% of kids have this. Well, I had them all. And so after a lot of talking with our pediatrician and doctors, they finally decided, yeah, there's an issue here. What is going on? So they decided to do some genetic testing, some testing in that form. They did quite a bit of testing from the time I was born till I was 4. We didn't know what was going on. They finally, at the age of 4, diagnosed me with Noonan syndrome. Then from when I was 4 till I was 8, nothing again. We were trying to find ways to help me develop, to grow, to do all of that. Because at the age of 8, I had the bone structure of a 4-year-old. We met a doctor who was a geneticist. And she said, her name was Dr. Antonio. She walked right in and looked at my features and said, he has Noonan syndrome. Just from these few features we're going to point out to you guys. So let's go into that list. My wife's going to read it and she's going to point them out. These are her favorite things, I guess, about me is what she says. So be patient with us. We'll try to kind of do side-by-side comparisons and explain why they're that way and what's going on.
They are my favorite things about him because they make him special. And I wouldn't have him any other way. So, the first one we're going to talk about is this little groove. Someone can tell me what the scientific name is, and that would be awesome. Because I don't know what it is. Because I know it's got a name, but I don't know what it is. So we're going to call it the deep groove between the upper lip and your nose. So this is here. If you look at mine, it's there, but it's not super prominent, right? We can come in a little closer. See, there's mine. Now, if you look at his is deeper. It's a lot more prominent, very much there on his face compared to mine, right? Even when we smile, his is definitely a lot more prominent than mine. The next one after that is widely spaced eyes. And again, if you look at our faces, you can clearly see mine are closer together. His are very much, you can see, wider apart, which I actually never noticed until he very much pointed it out to me. The next one are low set ears that are rotated back. And I'm going to use a trick that our pediatrician actually taught us when our daughter was born. He was worried about it. And so the pediatrician taught us if you draw a line from your nose back to your ear, you'll match. And if you draw a line from your mouth to your earlobe, you'll match. So you just watched me do that on myself, and I matched up pretty perfectly. You're going to see he's not going to match perfectly. So if I draw from his eye back, you're going to see I come up above his ear. And from his mouth up, you're going to see I pretty much hit like in the middle of his ear right here. So that shows you that he does have a low set ear. And if he does another side look, you can see, comparing to mine, this is kind of my weird ear. My family called it my cauliflower ear, so it looks a little weird. So maybe I'll show you this ear. But if you look mine up, pretty much it's not like it's a normal ear. This does rotate a little further back than mine. And if you need to see any of these closer up, or you want us to talk a little more specifically about any of these symptoms, or not, I guess they're not symptoms, but features, let us know. We're happy to do a video about them. The next one, I didn't know he had, but it's in his mouth, and I don't really look in his mouth. That's gross. I'm not a dentist. Is a high roof arch mouth. So he can tell you about that because it's not on me, it's his mouth.
It's just higher set. It arches higher and it's more up into my nasal passages a little more and stuff like that.
Cool. The next one, we're going to stay in the mouth for the next couple, is poor teeth alignment and a small lower jaw.
If you were to see me bite down, you would see my top teeth overset my lower jaw. I have really bad teeth. This whole front is a bridge. and every one of my teeth have had a filling in them, to root canal, to something done. They just continue. No matter what I do, I can brush, I can floss, I can do all of that. It's just part of the Noonan syndrome, the bad teeth, and that eventually they'll have to do something and probably have implants or something like that done.
The next one, and if we sit up straight, I'm a sloucher, but he's sitting up straight. But what's missing? His neck. They have a shortened neck. So if you compare mine, I have quite a bit of neck, and that's just me sitting up straight. He very clearly has no neck, which is fine. Doesn't bug me at all. I actually quite like it. It's special to him, and I wouldn't, like I said in the beginning, I wouldn't change him for anything. The next one, I am the only person that ever gets to do this, and I'm shocked he's letting me do it on camera, because they come with excess skin. Most of the time, it's around their neck / jaw area. Now, I cannot do that. So, not like me. That's very clearly,
More webbing in my fingers.
He's got webbing in his fingers.
I got more skin on my elbow.
They can get, he's got on his elbow and stuff, they do get excess skin other places on their body too, but it's most common right in this general area.
In your neck.
And, I really am the only person that, his mom can get away with it.
Every once in a while.
But I'm the one that gets away with it the most. And that's just because I'm the wife and I'm special that way, I guess. I don't do it very often. Well, I might probably do it quite frequently.
Yeah.
It's fun.
She likes to pester me. But I guess that's a wife's job.
That's what I'm here for. The next one is between 50 to 70% of them have a short stature. Nothing wrong with that. Let's just put it into perspective. I am 5'9", he's 5'7.5". So yes, we have a height difference. It does not bug me. We get looks when we go out in public, but you know what? I love him for who he is, and I don't care what other people think.
So we're going to touch on this one just a little bit more. The reason why I am 5'7" was when I was 8 years old and I met with that doctor, as we discussed. Her name was Dr. Sarantonio. I was the bone structure of a 4-year-old. So I was as tall as a 4-year-old child, and I was not growing, was not producing it, was not doing anything. I was getting the pains in my legs like I wanted to grow, and my body was trying to grow, but it wasn't happening, and I wasn't going to grow anymore. So after having a discussion with her, as she instantly walked in and said, these are the things we're going to do for him, which was weird for us because we had never had that. Never had that. This was in 1999 or 98. And so it was just kind of blew our minds to all of a sudden have this person who was willing to do stuff. She put me on human growth hormone. And a lot of people really get worried about that. There are some side effects you can get from it, and there are some fears and stuff. And me and my parents, and they included me in this conversation, and we talked about the pros and cons. And we decided that height and bone structure was worth the risk. And if anybody asked me today if I felt like that risk was worth the reward, I would say 100% do it. I would say if you had the chance to give somebody 2 inches, it would be worth it. Would be worth it, because I know I fought for every 7.5 inches I have, and I know the confidence it's given me. And also, what's funny is this isn't proven, but it built my immune system. All of a sudden, I stopped being sick all the time, feeling weak, all of these things, developed my muscles. It just helped my development all around. And so I would say if you are in the position where you're wondering if it's worth it or not with your child, have an honest conversation with your doctor and find out the risks. But there are huge rewards to it. And me being 5'7", I am one of the taller Noonan syndrome kids. I am. It's really interesting as we talk about this. I finally decided to go get fully tested for Noonan syndrome and have a legit, because when I was diagnosed, there wasn't really a test. They just kind of said everything aligns to where you have Noonan syndrome. We finally, at the age of 31, went and got tested. and I have the PTN11, which is the most common Noonan syndrome.
And what's nice now with genetics is when we were pregnant, we opted not to do any genetic testing because we just didn't feel there was a need to. But we did find out that because we know the exact Noonan syndrome he has, they can genetically test on the mom and baby, and if the baby has it, they can actually find which one it is while the mom is pregnant, so that you are already well prepared. So from the time he was born to now, science has significantly improved, which I thought was pretty awesome. But like I said, we didn't do genetic testing just because we just didn't feel we needed to.
Yeah, we were fine with whatever we got.
We were gonna keep what we got. So,
and we're gonna talk more about that. There is a 50% chance I can pass it on. And for a long time, I said I was not gonna have kids. Wasn't gonna do it. Wasn't gonna take a 50% chance of letting somebody go through what I've gone through in my life, from pain to growing to some of the surgery, stuff like that. I wasn't going to do that to somebody. But after I met my wife and saw the kind of mother she is, I knew it would be okay with whatever. And we're going to go more into that on more videos. I feel like that one really needs to be touched on. And I want to put a special video to it.
Yeah, and we'll kind of talk about why he says he saw what type of mother I was. Our first daughter is not biologically his. She is from my first marriage, and we can talk a little bit about that. I won't go into, I can go into a little bit, but I probably, just for legal reasons / her,
we're trying to keep the
kids
like that. We're trying to keep the kids out of this.
But
and a little
I can kind of give some backstory of why he says that in that future video. Yeah. The next one is a sunken chest or protruding chest.
I'm going to show you guys the chest just for scientific reasons, just so you can kind of see what it's doing, so you guys can understand. I'm going to try not to have YouTube block it out because, but.
Okay, so you can see his does not protrude out. His is sunken. It's right here in between the pegs. And you can just kind of see as I put my hand in there, it is sunken. It is actually my favorite attribute about him. And I don't ever want it to go away. It's not super bad, but it is bad enough that it's considered, bad. If he's hit in the chest, it does hit and bump his chart and his heart, and it's probably terribly uncomfortable. I wouldn't know, but it probably is terribly uncomfortable.
It does hurt a little bit, but
lost my spot.
Curvature of the spine.
Yes, curvature of the spine. I didn't actually know he had that, but when he bends over to touch his toes, you can see it's just a very mild curve in his spine. This is not super bad. Most people have some sort of critical congenital heart disease or some sort of heart problem. He has a small pinprick between the
left and right chambers on the top.
Now, some babies have to go immediately into heart surgery. Some babies don't have a heart problem. Some of them, it's like his, and it has to be fixed later in life. His isn't super bad, and it just gets monitored. So every once in a while, he has to go in for scans and ultrasounds and stuff like that.
They just really watch it, and I'm really aware of if I feel anything weird, I need to go get it checked.
It's actually kind of fun because when you go to doctors with him and they listen to his heart, it echoes
because of the shape, and
and then the heartbeat's a little different due to that pinprick. And so when they have students, sometimes they let the students listen, and the students like, what the heck? Yeah, because it's different, and so it's just kind of fun.
It's a great learning tool, I guess, to say.
In fact, his brother listened to it with his fancy his brother is a nurse practitioner, and he's got fancy stethoscope, and he was like, whoa, because it was in his fancy stethoscope. He thought it was pretty cool.
The bleeding disorder.
Bleeding disorders. We'll cover that more in detail in a further video too, but most of them come with a bleeding disorder. Some are super mild, some are more severe. I don't think his is super severe. He did have to have in our first year and a half of marriage 4 major surgeries. And with each one, they worried about his bleeding disorder, and it really only made a major appearance in his...
When they had to give me the blood transfusion.
Oh, yes. It did come up twice.
Yeah, it did.
But the major one was the very last surgery he had, and thank heavens we switched surgeons and had an amazing surgeon who caught the problem and was able to fix him and make him all better, because he legit probably would have died.
Yeah,
we'll go into more detail. We'll do a video dedicated specifically to
my surgeries, and we're gonna give you guys a warning because some of those can be kind of graphic.
So if you're like not a blood and gore person, you can skip over that. The story's kind of cool, but if you don't want to listen to something like that, feel free to not.
And there's been several surgeries I've had, so there might be more than one video.
The next couple we have was just like a few left. The next one is some of them, not all of them, but just a few have special education and developmental needs. He did have that.
I was more on the mild, not anything big, just needed a little help here and there.
And still, as an adult, sometimes he does still need help, and his mom and I are happy to help him. It's not a problem.
Yeah. Just know I succeeded in school with my help I needed because of my loved one. I had my mom as my advocate, and I learned very young that an advocate is great. The ones with disabilities, don't be afraid to have an advocate. I am who I am today because of my mom. Let's make that very clear in this video, that I have succeeded. I have a wife, I have children, I have a job. I am a valuable member to society because of my mom. And now that I have left home and I have my wife, I use her as my advocate. And anything from sending emails for work to
meeting with doctors
to anything I need. And so remember that you have loved ones around you that are advocates. And if you feel like you're doing this alone and you don't have anyone around you, there's state stuff that can give you help that I can give you that information on, and I can tell you who I used to help me through school and things I did and that. And we're going to touch on all that on more videos. And again, please feel free to ask questions. Remember, subscribe to our channel so that we can see your guys' comments and we can help you guys. And parents, people with disabilities, loved ones, whatever it is, if you don't know where to go and you're embarrassed to ask us. We're not here to judge and we're not here to make fun of. We're here and we're doing this to help people, to make the world a better place and be kind.
And like I said, if any of these stick out to you and you want more information and you want us maybe to do a video specifically on his learning disabilities and his developmental needs, let us know and we can absolutely make that work for you. Or if you would just rather shoot us an email or,
whatever,
and have us answer questions that way, we're happy to do it that way. So the next one is vision and hearing problems, and I think the vision one is kind of funny just for him because him and his sister are the only two members of his family that do not require any glasses, contacts, anything
I have
like that.
Perfect vision. It's the only thing on me.
Everybody else has to have glasses, contacts, or LASIK or some sort of surgery to help their eyes. Him and his sister don't have to do that, and I just find it funny because he does have the hearing problems. And someone has to wear hearing aids. I'll just kind of pop it out, okay? And we had an awesome doctor that we actually found through his job, through one of the teachers that he worked with, and we got hooked up with him, and he's awesome, so shout out to him. He's been the best thing to help get his hearing on track, because with every ear infection this one gets over here, he loses more hearing.
And I can tell you, it was really embarrassing to all of a sudden have to wear hearing aids, thinking, oh great, I'm an old man, I'm 30 years old and I happen to put hearing aids on. But I can tell you in that first day, I noticed a difference. I looked at the world in a different way. And everything I had been struggling in my communication and my volume tones and everything changed. My wife has a funny story.
He goes to work at 5:30 in the morning so he can get to the school by 6 at the latest. And he called me at 6 o'clock in the morning. And I was like, dude, I'm
asleep over here.
I think I was probably asleep, waiting for my alarm to go off to go get the oldest up to get ready for school. And he called me and he was like, dear, did you know your shoes make noise when you walk on the carpet? And I was like, well, yeah. And of course I'm thinking, well, of course I knew that. But then I'm like, well, he hasn't been able to hear that for years. So of course
I've never been able to hear that.
That's a new, exciting thing. And he's, the wind makes noise and your hair makes noise and
grass makes
your
noise.
Your fingers make noise when you rub them together. And he didn't know all of these things. And so it's been really fun for me. And I think even secretly for your mom. It's been fun for like everybody that knows him to see him enjoy these little things in life that he's not ever really been able to hear. Maybe once when he was a little boy, but like I said, that was years ago. He's not going to remember that. And so that's been just super fun.
I think that's all of them.
No, we've got one more, and this is one that his mom is going to cover later, because I don't have a Noonan syndrome baby. She did. But they do come with feeding problems. I do know that he couldn't keep food down, whether it be breast milk or formula, so he had to have a specific type of formula. And like I said, his mom is happy to come on our channel.
We're going to cover that one in development. I developed a little slower on things, from rolling over to crawling to things like that.
And that's where she's going to come in, and she's going to fill in there, because I obviously was not there for that. So she's going to come in and talk to us from her mom's standpoint, and then maybe we can convince his brother to come in and talk to us from the medical standpoint.
Right. So again, if you guys have any questions, please subscribe to our channel. Like I said, my mom would happily help us answer questions, and so would my brother. Thank you guys for watching our video and taking the time. I know this one was a little longer, but I felt like it was much needed for our second video to cover these things. Have a good one.